Thank you. Good to be here. Some interesting talks. I think Vic Chan has made my day. I thought that was a fantastic piece of work, and I look forward to that starting to move medicine forward in a positive way, because it certainly hasn't been that forward up to now, as I'll touch on. I also wasn't as pessimistic about Dwayne's talk as you were. The only thing we have to do is, if the money's being diverted away from farmer investment, then all these other projects and all these other side streams, it's up to us to try and get some of that money in order to produce some preventive and treatments that might actually work, more than just the amyloid theory that's been going badly wrong for 25 years. You started the conference talking about longevity, which I thought was quite good, from the quote on the front of my opening slide, which is, however else you live your life, live it freely. It's not the years in life that counts, the life in years, because I think that's really what we're trying to talk about. Longevity. There's no point living to 90 if the last 25 years have been substandard. So I think that's a good idea. So the Opticrhonix story started out of pharma, very much out of pharma now, but and we were looking, René and I were talking about modifiable risk factors, and everyone talks about them, everyone publishes data on them, but no one comes up with a way to sort it out. Until, of course, the finger study, which was a very good study. And of course, when everyone talks about 99% failure in Alzheimer's studies, they never include the finger study as a positive study, which it was and continues to be. And also the work of Danone with Suvinate. Some of those patients 5 years on with MCI have still not progressed. Now, that might be by chance, but certainly the studies have been positive, but universally ignored by most of the academic institutions. So I think that lifestyle and modifiable factors is important. We know from literature 80% of chronic disease symptoms can be ameliorated by lifestyle changes. So one of our premises was, so how do people find out? They don't read scientific journals, they don't read curated stuff in some of the magazines and stuff, but they all use smartphones. And even in remote parts of the world, China's got 75% smartphone use now. People use smartphones. So we thought, why don't we start looking at technology in order to get this information across in an accessible way? The Fingers group's doing fantastic. It's just, it's gone through 1,000 enrollments, but, we're talking millions of people. And, so some of the work, some of that research, if we can get that out into the public domain on a smartphone, using technology to identify personal risks, very much the same way as Vic was talking about, but then also building in coaching programs, so that having had risks identified, if people want to do more, can they do it? And that's what myAVOS, our app, is all about. From my perspective, I'm a retired researcher. I've done many of those clinical drug trials that Dwayne talked about. But right from the time I was made a consultant, I always knew I always had to learn more. But also I felt, as a specialist, what I should do is be departing enough knowledge to other people to make myself redundant. Because, there's no point in me having all the knowledge if the public haven't got it. And I very much agreed with what Brigitte said at the beginning about, people coming forward, people understanding, people being empowered. And also, I don't want dementia or any disease, but dementia particularly, it shouldn't be a passive relationship where you go to a doctor who tells you what you've got and what you should do. I think people should learn how to do more for themselves, and I think she's a stunning example. I also live in Portugal, so I was interested on the two projects that are having some work doing in Portugal. And I try and live up to lifestyle factors by taking my dogs for walks regularly in the sunshine and eating the right food. So, what's Opticronix about? We've heard some of this from other presenters. The healthcare costs are rising, and we've got this. We call it healthcare, but actually, really, we've got sick care. We identify and try and treat illnesses, and then Medicare and other people might come and put barriers in. But there's few innovations at the moment to protect health, and most incentives reward sick care. So and dementia has become a sort of fatalistic thing. The health has become fatalistic. In many ways, the Western society stroke food industry have created a lot of problems. And then we create pills that solve those problems, diabetes being a true case in point. I mean, it's not just treatable diabetes. You can eradicate it with 8 weeks of 800 calories per day. So we're not really pushing prevention hard. And I think the question about are doctors ready for some of this earlier on, I think it's absolutely true. I mean, I think that doctors do what they've been taught, but they don't think about what they could do to help things differently. We need to move from this sick care paradigm. We need to, become anticipatory. We need to have planned interventions. I love Vic's stuff. If we could move it back even earlier, that would be great. The big difficulty then is a lot of this relies on having a label, which we call a diagnosis, which are probably going to change over time. And as we've seen in dementia, we're not sure we've got the labels right anyway. We've got mostly mixed disease and various things. So what can we do? And for me, the perspective, having worked 30 odd years in health, is I'd just like to get patients back in control at the center of what goes on. It gets talked about, but I don't think it gets done properly. And I'd really like to see people using apps for their health in the same way as they do for everything else. 10 years ago, none of us really trusted banking apps. Now we can't live without them, and the banks are all closing down. The security on apps is probably as secure as anything else. The barrier to moving into app-led healthcare, I think, is going to start collapsing fairly soon. So healthy aging, we heard this already from Vic, but 59% of people may suffer from 2 or more morbidities. I mean, the American study that he quoted was more recent and even more scary. But when you look at modifiable risk factors, there are studies to show they could prevent or delay up to 40% of dementia cases, which is pretty stunning. We're talking about spending trillions on pharma research and the cost of drugs. Actually, if we could prevent or delay 40% of Alzheimer's cases, we would be on a winner. We couldn't spend the savings. So, we need to think about that. And the other thing is that dementia hurts other people as well. The carers are probably the most valuable people around in the ecosystem of dementia, but 84% need more help and they need better information. Some get to go to teaching programs in memory clinics, but a lot of it is, pretty much learned ad hoc. And I have to say, a lot of the stuff they learn for themselves is pretty useful for us to learn from them as well. Up to 70% of county caregivers have depression. So, can we detect that more easily? We know that families try and do the best they can and say they're all right when they're not. Are there ways we can tackle that? And we know that, partly because of the age of partners and various things, that 22% of people looking after a person with dementia may progress to MCI, and of which 10 to 15% of those will convert into Alzheimer's cases. So they're already a pre-stressed population that we could probably follow better. This is a very busy slide, which I'm not going to go through in lots of little minute detail, but it kind of sets out the stages where we're at the moment and where we might be able to try and help. So, if you had a smartphone app that gave you some knowledge about yourself, rather than have a subjective memory problem, you might have an objective data on your app to go and talk about. So you've got your own personal data to go to a GP and discuss with them. The GPs sometimes say, well, I don't think you're bad enough. This would be different. This would be right. Okay, there's a change. It's a change from my own personal baseline. So you would get a referral to a memory clinic. 25% of the people waiting for a memory clinic got subjective memory loss. Therefore, they're filling out waiting lists that when they might not need to be there at the moment. And we heard from another presenter, about how anything that helps increase health efficiency will help reduce the problem. Once you get to the memory clinic, if you've got mild cognitive impairment at the moment, unless you get into a research study, that's it really. It's come back in 6 months, we'll have a look, maybe come back in a year, we'll have a look. This, smartphone, if it coaches you, it can tell you some of the things that you can change. It can tell you and coach you on some of the ways to improve. So right from the time you start worrying about your memory, you can actually start doing something about it. And it's you that does it, it's your decision to do it, but it's all treatments and exercise, food, whatever. It's all things that are proven in research that you can do for yourself and monitor how you're doing with it. Once you've got a diagnosis, it's real-time data collection. As I'll show you in a minute, we've got cognitive testing within the app. You can start looking at whether a drug's working or not working, which might actually reassure some of the payers when it comes to expensive drugs. So I think we can use technology to improve the current pathway. We've heard this already from Vic and others, heart disease, diabetes, dementia, they're all interrelated. If you treat them all individually, then you get results. But like an orchestra, if you start actually having a single holistic digital health platform, you might be able to do two things. One is get better outcomes. The other one is to show to people that their health is integrated, not just about the going to see the heart specialist, diabetes doctor. In the UK, with these chronic health conditions, people go to the GP 3 or 4 times a year with these conditions to be checked, but never get asked about their memory because that's another box. So I think healthcare, while it improves for having single specialist entities, people need to be treated more holistically. So if we had a app that predicts late life dementia risk, it also includes cardiovascular risk and monitors cognitive change, which we at the moment we're targeting mild cognitive impairment, but really if it became something that you used from your mid-40s onwards, you'd have personal data to inform who you asked to see or who you wanted to see based on the 5 pillars of healthy aging, which very similar to the finger study, but includes sleep and other bits and pieces, where both patients and caregivers are supported. Then we would have a world where patients would be controlling their destiny more. We'd have a situation where people were coming to see specialists or primary care physicians with data that was discussable and getting to see specialists at the right time. How does myAVOS do this? And this is the last slide, and so we can have more discussion. So it uses various assessments, including the adaptation of the KD scale and a cardiovascular risk assessment, in order to produce health outlook and risks in both brain and in heart. The drawing there is our cognitive test. It's in partnership with a cognitive speech marker company, where all you do is describe a picture. So it's a complex picture, you describe it for 15 minutes, you record it on your phone and you send it off, and it comes back. And it comes back with answers in the 6 domains that you can maybe able to see on the screen. It's a bit small, but they're basically 6 domains of cognition. And so you've got a report saying you're okay in this, you're okay in that. Simply for personal use, they're all validated instruments. You then, on the app, you profile your lifestyle factors. So you calculate the weight, your cholesterol, all the standard stuff, and we can produce interventions based on that. And anything that's found either good, we can encourage, but anything that's we know is detrimental to long-term brain health, you can then go into a coaching system which tries to address your own personal barriers as to why you're not exercising or while you're eating badly and all the rest of it. Within the lifestyle factors, we've got a food app where you can just photograph food and they'll calculate rough caloric intake. So we can, you can use your smartphone as you would for many other things to try and get information that, it's laborious if you've got to start data logging various things. We're trying to make this part of the normal smartphone experience. So then you get this AI generated, curated personal content. So if you've got good habits, we encourage them. You've got bad habits, then this coaching program goes on. And the first thing on my buddy is just taken from one of the coaching examples. The numbers in the one in the middle there, if you've got memory deficits identified through the cognitive testing, then there are a series of exercises that will match the problems that are identified so that you can start doing some cognitive stimulation practice. And then the I can't read the last one, but anyway, it's another part of the coaching thing about how about exercise. And finally, this is on a personal basis for anybody. So therefore, what we've done is we've linked it so that only one person can connect to 5 other people that they want to. So if you've got early cognitive impairment, you can link it to your partner or your family. People in Australia can see how their parents are doing. And eventually, we're not doing it yet, it's conceivable it could link into electronic patient records and other things. But the idea at the moment is that you can test a person who's worried, you can test the partner and or a family if they want to, but you can see if the situation is stable. We've also got a activity to daily life questionnaire within this, which you ask the patient and you ask the carer, and then you overlap them so they can look and see on a map what the truth is, somewhere between what the caregiver experiences and what the patient thinks they can manage. So it's quite informative from that point of view, because many times I was in clinic when people would say, I'm all right, I can do this, I can do that. And the carer's sitting there shaking their head saying, no, they can't. So this collects a lot of that data. And of course, the other thing it does, if a caregiver's collecting data, this asks about anxiety, depression, various other things. The speech biomarkers can pick up depression. So actually the family can pick up whether a caregiver's in trouble as well, even if they're saying they're okay, to a certain extent. So in short, what we want is to promote more responsibility for personal health. I think that's key to the prevention agenda going forward. I think the second thing within that is that people need the information to actually take the responsibility for personal health. And I think that, a smartphone, which you're using for every other daily activity, we ought to be able to do something like this with cognition and with chronic health, and try and move towards 80% reduction in chronic symptoms across the board, and hopefully gets even a tenth of the way to reduce to making that 40% reduction in people with dementia. And I'll leave it at that. Like I say, it's not a comprehensive or demonstration performance. 20 minutes is not long enough, but we're very keen to start a movement towards personal prevention and people having things to discuss with their doctors, not going to them hoping that their memory problem isn't serious. I'll stop there.
Thank you. Really nice, and looking forward to see this. I was just wondering if you have a solution for subject like Brigitte, who's by herself, and whether you...
Well, so I mean, to her, to what she was saying, would it be good for her? Yes, obviously, and even before, because she's been diagnosed for a while. Yes, she's a unique individual in that she's highly motivated, highly driven, and looking for solutions. So yes, this would help. I mean, you know, I suspect most of the things that it would tell her to do, she's doing already. But what she did say at the end was, it shouldn't just be me. This should be something that everybody could have and scalable. So yes, anyone that was in the position that she was in when she first thought my memory is not as good as it should be, this would be a great place to start. And it may be, I don't know her history, I don't know how long it took her to get diagnosed, but for most people in that position, still at the moment, from having suspicion of memory loss to getting seen by a specialist can be up to 3 years. So, you know, if after 6 months, so the definition of dementia is if you've got a permanent problem, cognitive problem after 6 months. So if after 6 months you've got data to show that you're not as good as you should be, and that hopefully in years to come would be against your personal baseline that you had before you got any problems. So if at 6 months you can show a permanent decline from your baseline, then people have to take it seriously. So if you do nothing else, you get people early diagnosis in 6 months rather than 3 to 4 years. Does that put increased demand on memory clinics? Maybe, but they've got a lot of baseline information with which to work with. Would it put up waiting lists? Well, hopefully it might streamline waiting lists, because if you take off 25% who are going to find out if there's something wrong, they haven't got anything wrong with them, then you've immediately got a 25% increase in capability for memory clinics. So, yeah, I think that, you know, for people like her, she also made the comment, which, you know, I'm guilty as anyone of having had very early memory clinics in the 90s. 3 hours of cognitive tests is no way to spend your afternoon. So anything that can be done that's reliable and short, you know, and we're seeing innovative tests, innovative various things, the speech biomarker work, various things. We can cut out 3 hours. Now, I'm sorry, I apologize to all neuropsychologists who love to sit there and do 3 hours of tests, but people don't like it. If we could go do 45 minutes a month of tests, and that's a month, not every 6 months or a year, then we get a much better picture of the individual. And you know, things like VIX care plans, you can see if they're working in real time with a smartphone now. You know, I think this is the future of chronic health. I don't think we should be relying on, you know, others. Like I said in the talk, diabetes.
I think in Scotland they have brain clinics where people can go, like just to walk in and they get screened. Maybe they would be interested to partner with you. I could put you in contact with Brain Health.
Yeah, no, that would be very good. Yeah, and we're interested in partnering anyway. I mean,
Hassan has a question, and then we have to move on. Hassan, sorry.
Oh, yeah, quick question here, please. Yeah, thank you. So there's 2 words which have been basically mentioned before, is prevention and the root cause. So from the root cause, I think it was Nikki who mentioned that the root cause is that we know a couple of root causes are getting into this disease like Alzheimer or similar. And prevention is where we should focus. So the question here is, what are the bottlenecks on the health systems across the different countries to boost and support further the prevention? Because that's the best way to avoid getting into the disease. Basically, this is what you mentioned, Roger, right?
I think you're right. And I think they are tied together. You know, it's not an easy answer. It might be one that picks up more on the panel. But so if you know what a root cause is, then I guess you can prevent it. This is complex, and you know, some of the root causes could be, or will be, biochemical and protein reactions to harm that's done by things that we do commonly. So, you know, diabetes, lack of exercise, various things. You know, you can produce lots of scientific papers on, you know, the effects of exercise on proteins within the body. So, you know, and the Western society has fallen into this chronic problem around lack of exercise, too many carbohydrates, whatever. So I suspect the root cause is based in scientific evidence that is there, but not, because causality and association are not the same thing. So we tie ourselves up in knots. We wait until we've proven something before we do anything to prevent it. We've got lots of data on things that people have tried to do to prevent something and it's worked, but because they don't understand it, they don't then do it.
Right. Yeah.
So my attitude now is, retired doctor and the rest of it, just do it. Don't keep asking. Don't do it. We mustn't do anything that will harm people. But most of what we do, ask people to do to try and prevent brain failure, for want of a better word. We all understand other organ failure, but most of what we don't do, we know you shouldn't eat loads of carbohydrates, but the food prices go up and we feed people rubbish.
Yeah.
And the proof of that is if you look at the increasing rates of cognitive impairment and dementia in the non-Western world, it's happening because they're eating Western food.
Mm-hmm. Yeah.
You go to Bombay, you can buy a curry burger, they dehydrate curry and make it into a patty and then serve it out between bread.
I think we have.
I know. Let's take it up with the panel. Thank you.
Manfred, yeah, we should take the question for the panel. Manfred, do you have a question now, or you can?
I can put it. If Roger is still on the panel, then
I'm on the panel.
Perfect. We are. Roger's in the panel.